I think that it's a very exciting period of time, right? I mean, we have treatments, but we see many other treatments reaching patients' bedside at the clinical trial level, and some of them that are approved nowadays. Um, Nevertheless, there are some aspects on which drugs may help, but not only drugs. And I think that one of these aspects is certainly the central nervous system involvement. Um, we are very lucky to have with us some Goyans who could help us through this different CNS issue in these kids and what we can potentially propose to them and to the family.
Yes, indeed. I think it's very important to also be aware that Duchenne muscular dystrophy is not only a muscular disease. Of course, the physical symptoms are very severe and very prominent. And I think in some points of the disease course, they deserve the attention they can get, but also the behavioral and cognitive aspects, the CNS aspects, are very important. And in some parts of the child development, they can be very manifest and even more burdensome than the physical impairment that the child is experiencing, especially for the parents and especially for the surroundings. It can make development very difficult. So I really think as healthcare professionals, it's important to screen for them because not all parents are aware that they can ask questions about it in a medical setting like a hospital. So it's important that we ask them about behavior, that we ask them about academic achievements or about how the cognitive development is going. Not all of those aspects are very clear in the beginning because all children are often very young when they come to us in our neuromuscular center. But when we follow them through their development, we can see that some problems are becoming more manifest, and then we can intervene or can give them some advice how to cope with it or how to deal with it at school, for example. So I think from the beginning, it's important to inform the parents that when they see something that is difficult to deal with, that it can be a part of normal development, as every child can have a difficult period. But it also could be a part of Duchenne muscular dystrophy, and that they can talk with you about it, how to cope with it. So if we don't give them the background of this, and if we don't give them this information, they can think that it is a problem with themselves or with their parenting skills. But also for teachers, it's important to know how to react on some behaviors. In this slide, it's very important again to know that some Duchenne muscular dystrophy patients need more repetition. They have difficulties to learn new skills. That can be learning, academic skill, but it can also be social behaviors. So sometimes we really need to explain to them why we do something. Some things we really need to make things explicit. So that's very important to know. I think there are some things that we can do about it. If it's really difficult and really difficult behavior, we need to refer to specialized centers like child psychiatrists or child psychologists. However, in the general population, Duchenne muscular dystrophy is not very, if they know, is not a thing that the general psychiatrists know about. So it's important that you give them the relevant information so they can get the expertise and they can integrate every aspect of the child. We see that some patients are very well helped with psychotherapy, especially cognitive behavior therapy can be helpful in some cases. And we also see that psychopharmaceutical drugs can be part of it, that it can be safe even in patients with a neuromuscular condition, and also be effective, and that they are very well helped with it. And I really think that we need to be very attentive for parents because the burden of the CNS aspect can be very hard. And of course, it's a chronic condition, so they have to endure this through a long period of time. So self-care and sometimes searching for possibilities to give the care for the child to someone who can help with it is very important to keep going on the long term.